But then away from the politics a little bit, we've seen that the Ministry of Education has asked schools to let teenagers who got pregnant during this lockdown to actually sit for their exams and not send them away, because we've seen as policy in most schools that a lot of students during the exams, especially final ones, if they find out that you're pregnant, you actually don't sit for your exams. And even without the fact that people have been at home and teenage pregnancy has been at a spike, we need to look at a situation where at the end of the day, people need to sit for their exams, pregnant or not. So for me, it doesn't make sense that you go to school because you're pregnant, they stop you from doing examinations. What are you, the church or the mosque? You know, so I will call upon the Ministry of Education to launch the fact that even after the COVID-19 situation, students who are pregnant during the school days actually attend their classes and do their exams, because the harm has been done. Stopping them from doing their exams is actually adding salt to the wound. So why don't we make this a statement to all schools, even after the pandemic, that it has to go on. Now,
still about, before you take it from that, the information I got to know about the schools that are going to be reopening on the 15th of next month is that amasomero ga private gonna agatali verified by the Ministry of Education and Sports tegagenda kugulwawo. So bafulumiza certificates empya nga ziri tosobola zichupula in a nutshell. So ezo ze bagenda okubanga bagobera. So amasomero gonna aga private nga tegali verified. Now, the Ministry of Education and the President were saying that the private schools, abalina students who are not going to open up, can move those students to the government schools that are going to be open. But then the question is, what is the capacity of the government schools that they're leaving open for these students? Are we going to handle the influx of these students that are coming back to school? And the fact that at least government-aided schools have some fund to start over this particular time when COVID-19 is in our faces, the private schools are going to fail. That is the truth. Because when we see the SOPs that are put in place, not all of them are going to manage, especially with paying the teachers and making sure that the students are spaced. Now we see Chameleon University has actually told its students, Temugenda, to sit the exams if you do not pay the full tuition, which is something that a lot of people have condemned, because they say in this COVID-19 situation, abantu bangi nnyo tebalina ki sente. Kati, you're saying I cannot sit exams if I don't complete my tuition. What are you trying to say? It's useless for me to come to school. So parents are calling upon the government to look at the Chameleon University statement and see that something is done on that regard. Meanwhile, let's dive into our first story that we need to discuss according to our producer. That is from the Ministry of Health. Yafugambye nti yafulumiza new testing kits. Zebagenda okubanga bagezesa zijja kubeera nga they are slightly cheaper compared to ezemitwalo 24,115. Fena tukimanyi emabegakaawo Ministry y'ebyobulamu yafulumya ekiwandiiko ekigamba nti buli munnayuganda ayagala okwekebeza oba olina company ng'olina abakozi bo oyagala okubakebeza ekirwadde kya COVID-19, then that means you were supposed to be subjected to the 245 Ugandan shillings. Waliwo n'ebyega byali bitingana bigamba nti nabo abava ebweru w'eggwanga nga bayitira through the Ugandan airport, Entebbe airport, you are supposed to be subjected to the 245,000. Naye ekyo kyavuddewo. Bw'oba ova wabweru ng'okomawo Uganda, kitegeeza ogenda kubanga oyina certificate oba results eziraga nti oli negative 72 hours ago. Oyitewo buyisi ogende makago, bw'oba oli mulambuzi ogende straight gy'olina okubanga olambula.
And the best part about this information is that they will be self-quarantine among these people. So you will not be entitled to be put into a quarantine place to be quarantined for 14 days. Because one problem with being put under quarantine by the government is that you pay for the fee of the place where they put you to be quarantined. And remember, there were a lot of issues that came up recently. And one of them was that in those quarantine centers, feeding is poor, hygiene is poor, and there's no spacing between the different people that have been said to be infected with COVID-19. However, as you're coming into the airport, ladies and gentlemen, when the airport is opening, people will be allowed to go in and out of the country. But as you're coming into the country and you show symptoms and signs of COVID-19, you'll be pulled to the side and you will have to pay the 240 and then put into quarantine because you show the signs and symptoms. But that's a good thing because earlier on they were supposed to pay the money after getting the certificate, Bakomeo, and all this process, which was too much for people, and they were complaining about it very much so. And I think they saw it because once you put that, tourists have agenda kuja.
Absolutely.
Because at the end of the day, I'm still going to spend money in your country, and you're putting me under these guidelines that I cannot manage. So that is what is happening. But as we speak, our country has a total of 8,017 cases. We have hit the 8,000 mark, and we're going into 10,000 very soon. You will not be surprised. We will not be surprised that next week, but when we hit the 10,000 mark. But the question is, how are you personally taking the initiative to take care of yourself? Because the government said there's no lockdown. No, new lockdown.
I also don't see it coming.
Do you think that we should have?
No, yesterday CS Bag had a press conference in the government Omulang. As Kenya and Tanzania, okay, I don't want to talk about Tanzania because naturally didn't have a ministry of your someone told me. Actually, they were complaining about us.
But you know why?
Those
wait.
TV, they are comparing Uganda to Tanzania.
Wait, let's take it back. Let's rewind and come back. Say they were complaining about you.
You and I.
You do
you
that.
And I.
Simon Chris, you are the one that talks about Tanzania all the time. And I tell you, Tanzania stopped counting and tallying its COVID-19 cases in July at 509, and they haven't increased or decreased the cases, and we are at a standstill. And I told you why.
No.
Tanzania.
Okay, not in a bad way. Not in a bad way. They were asking me asking you and I not to talk, not to compare Uganda. You like putting me in your car. Don't put me in your bus, Simon Chris Bakanga. Get an accident in your bus and do it on your own. Unless if you're denying me. Anyways, bangambye, wali yangambye nti babira batula mu Ministry of Health.
Yes.
So last time we were talking, we were comparing Uganda to Tanzania. Anga tugamba nti, why can't we go Tanzania way? Why can't the Ministry of Health officials or abali ku COVID-19
learn lessons from Tanzania?
Not learning. Bagende Tanzania.
Your word. Yes, go ahead.
How is Tanzania doing it, or how are they coping up with the pandemic? It was simple as that. So bangambye nti siddamu comparing Uganda to Tanzania ate mazo kyogerako. So CS Bag bagambye nti as Kenya has opened up literally all its economies.
Yes.
Bars are opening. Actually, they are working in Kenya. One of bars are still under lockdown. We still have other economies that are still under lockdown. Amulizi gym, sauna, steam bath, all those indoor activities, they are still under lockdown.
Okay.
But in Kenya, it's the opposite. So they are asking us that why can't we go Kenya way or Tanzania way, or how other East African countries are dealing with the pandemic?
Well, at the end of the day, the government still came up and said there will be no lockdown. Sometimes, however, when I see the cases spiraling out of control and the cases going up to 10,000 soon, I'm wondering, are we able to take care of ourselves as Ugandans? Because we say Tetwagala lockdown. We say we want these economies to be open. Kubanga, we have died of hunger for 6 months and we want these economies to be opened. But are we helping the government figure out how to open these economies, or are we making their work hard? Because at the end of the day, if you're not putting on masks, okay, if you have a problem with masks, buy the new masks that have zips in the front, you know, which will make it comfortable for you.
Did you read the president's tweet?
What did he say?
President byokukola mask ngeriko zip yagambe.
No, but at the end of the day, it's understandable. Omanya, the problem with getting drunk is at the end of the day, if you overdo it, you fail to control what you do afterwards when you get drunk.
Absolutely.
You don't know who you're going to hug, you don't know who you're going to speak to, you speak to everybody and all that.
People are so active. abantu babeera active.
And they can't keep social distance after that.
Maybe they can, but
Tabasobola when you're drunk, Simon Chris?
No, the activity I'm talking about, onaita wali, onaita wano, nakola bichi. So it's so binyuma okubeera mu balango lisobola abantu abatamidde. It's fun enough. Anyways, nga tuvuddeyo tusaba that Uganda
doesn't go back on lockdown.
No, tekigenda soboka naye tusaba all economies bazigule abantu baddemu kola sente. 6 months ng'omuntu atudde waka yali ayina ebbaala lye nga terikola agabamu bagezaako zifuula restaurants naye bigaanyi absolutely they are not working out. Omuntu yali amanyidde okugenda nti no lyali bbaala toyinza mukonvinsinga nti kati now it's a restaurant. It's so hard. It's
hard for them. I know with the 6 months lockdown, it's not easy. But as an update and to show us that the reason why some of these economies haven't been opened, we're looking at 75 deaths. You know that they have increased, right? And they're increasing faster than we think. However, the Ministry of Health is trying its best to cut down the COVID-19 and deaths in Uganda. Now, see, the best part about this whole information that we're giving is that we've had such flus in the history of the world.
True.
We've had MERS, we've had SARS, and even in those sicknesses, we've had too many people who have died, but they've lasted maximum 2 years, 3 years, and people have moved on from these illnesses, and we've moved to now COVID-19 era, where we know that we're going to move forward from it, and we're going to be better, and things are going to come back to normal.
Sure.
So let's just be patient and see how this things are going to work out, because if you look at the deaths and break them down from 2002 to 2014, we also had a similar thing like COVID-19. And that was SARS that was gotten from the bats, and it was also from the southern China. So in 2002 we had over 8,000 cases, and people died all over the world, and that passed. Now in 2012 to 2015 we had the MERS, which is the Middle Eastern Respiratory Syndrome, and it comes from camels to humans. Usually almost the similar, signs and symptoms. And we had 1,000 deaths and over 1,000 deaths, and it stopped in 2015. And we see that we had the Spanish flu. Do you remember the Spanish flu?
Yeah, I remember. It
that was the worst hit.
People?
Exactly.
No.
That
no,
was the worst hit. Actually, it killed 500 million. 500? Thank you.
Yeah.
500 million people in the world. And the Spanish flu was the worst thing that hit the world at that time. But I mean, we got over it, and here we are. And here we are. We're giving birth. We're growing. We're getting better. And then at the end of the day, even this flu will come to pass, is what I'm trying to say.
True. Ministry